Good afternoon, ladies and gentlemen, and welcome to this panel discussion. My name is Hesti Pramudita, as moderator of this panel discussion. Today we will discuss about the best strategy for medical waste problem. Now, medical waste being a problem to our environment, especially in Indonesia. It is because these wastes are disposed to the environment, which can make environmental pollution. The factor can caused by the lack of landfill and improper management of medical waste. This is the reason why we choose medical waste as our discussion topic. And now, we will have 4 speakers in our discussion today. They are Shinta Churrin, the Ministry of Environment and Forestry, Eka Shepina, a doctor, Adyatha Rafi Manaf, the Ministry of Health, and Nauval Dzaki Raihan, the cleaning volunteer. Before we start our discussion, I would like to briefly introduce our topic today. Medical waste is a subset of waste generated in medical facilities such as hospitals, clinics, dental offices, blood banks, veterinary hospitals or clinics, as well as medical research facilities and laboratories. In general, medical waste may be contaminated with blood, body fluids, or other potentially infectious substances, and is often referred to as regulated medical waste. Based on World Health Organization, medical waste classified into 6 types. They are: first, sharps. This kind of waste includes anything that can pierce the skin, including needles, scalpels, lancets, broken glass, razors, and pulses, staplers, wires, and through cars. Second, infectious waste. Anything infectious or potentially infectious goes in this category, including swabs, tissues, etc., equipment, and lab cultures. Third, radioactive. This kind of waste generally means unused radiotherapy liquid or lab research liquid. It can also consist of any glassware or other supplies contaminated with this liquid. Fourth, pathological. Human fluids, tissue, blood, body parts, bodily fluids, and contaminated animal carcasses come under this waste category. Fifth, pharmaceuticals. This grouping includes all unused, expired, and or contaminated vaccines and drugs. It also encompasses antibiotics, injectables, and pills. Sixth, chemical. They are disinfectants, solvents used for laboratory purposes, batteries, and heavy metals from medical equipment, such as mercury from broken thermometers. And the last, genotoxic waste. This is a highly hazardous form of medical waste that's either carcinogenic, teratogenic, or mutagenic. It can include cytotoxic drugs intended for use in cancer treatment. And now, we have the facts about medical waste in Indonesia. The Indonesia Ombudsman noted that there are at least 138 million tons of medical waste that were not properly managed. In many cases, medical waste is disposed of anywhere. Some are dumped on roads, rivers, seas, and landfills. From a regulatory perspective, there are still many regencies or cities that do not yet have local regulations or medical waste management. Meanwhile, internally at the health facilities, there are still some who don't have SOPs for managing medical waste. Likewise, permits for temporary disposal sites or TPS and wastewater management installation or APAL. Quite a lot of health facilities do not have them. So, their management is not in accordance with environmental principles. The difficult difficulty of obtaining permission was complained by the hospital. It could be that the standard equipment used by the hospital did not comply with the provisions, so the permit was not issued. Other possibilities are indeed complicated, like it or not, health facilities cooperate with medical waste processing. Collaboration with third parties disburses potential funds, while the waste management budget is limited. Health facilities that choose shortcuts end up doing something wrong, disposing of medical or LB3 waste anywhere. In the processing to stockpiling stage, health facilities that don't have incinerators with third parties. In South Kalimantan, there are no processing and stockpiling companies. In addition, there are only 4 transported business entities in South Kalimantan region. Medical waste is sent outside the area, like Bogor, Balikpapan, and Surabaya. Meanwhile, there are health facilities that manage medical waste using incinerators and sterile waste, some of which do not yet have a permit. In South Kalimantan, the management of medical waste requires a large amount of money and there are still limited human researchers at health facilities who understand handling medical waste or LP3. The processing of medical waste needs to get attention for the local government because of the limited number of medical waste managers, while the amount of medical waste that is generated is more. And in 2020, when COVID-19 was hit this country, medical waste were increased and polluted the environment, which can harm to animals and human health. According to Indonesian Hospital Association, hospitals across the country produce around 290 tons of medical waste per day prior to the pandemic. This figure has since ballooned to 493 tons per day. This waste not only produced by hospitals and clinics, but also produced by isolation facilities. The actual amount of medical waste produced by isolation facilities and households is unknown. However, the Ministry for Forestry and the Environment estimated that each COVID-19 patient can produce up to 1 pound 7 kg of infectious waste per day. So, I will to ask to our speakers about medical waste, and I will start with the doctor. What is your opinion about medical waste?
I, as a health team, especially doctors, I feel worried about this problem. I think this doesn't just happen once, but happen very often. The accumulation of medical waste has made local residents anxious about being exposed to various diseases, such as the events that have occurred in Indonesia in recent years, namely the larger number of used syringes found in irrigation canals, the discovery of COVID-19 infectious waste in several landfills in Indonesia, and based on data from Ministry of Environment and Forestry, from March 2020 to June 2021, the COVID-19 pandemic has produced 18,416 tons of medical waste in the category of hazardous and toxic material, or B3. This is not a light problem and is considered trivial. This is a serious case because if this continues to happen, it is feared that it will cause various problems such as threatening the life of living things, especially water creatures, and causing environmental pollution, and also facilitating the spread of diseases of virus caused by waste. And we at the hospital ourselves have tried to dispose of medical waste properly. We tried to wrap medical waste so that it was safe before disposal, and also group medical waste according to its group. So that is medical waste was not disposed of carelessly. I don't think this is purely the fault of the hospital. I also disagree if this problem is entirely caused by the health team, but there have been some negligence on the part of the waste management or mismanagement, as explained in Article 40, Paragraph 1 of the Environmental Management Law and Government Regulation Number 27, 2012 concerning environmental permits. It is impossible for a business or B2 waste management to be carried out before obtaining an environmental permit and or PPLH permit, because these two permits are requirements to obtain a business or activity license as mandated. As we know, medical waste cannot be managed from obtaining permission from the Environment Minister. This is what causes difficulties for medical waste manager to manage medical waste, because not all hospitals have permits for sorting medical waste, especially at health service centers in remote areas.
And so, what is the Ministry of Environment and Forestry's opinion about the doctor's argument that the improper management of medical waste is not entirely at fault of the medical waste sector?
Okay, thank you. So, as a representative of Ministry of Environmental and Forestry, we could say it is true that improper management of medical waste is not entirely the fault of the medical side, but it also comes from the household and healthcare facilities or Fashankes. For medical waste originating from household, regional governments are asked to participate in preparing facilities and infrastructure such as drop boxes. Meanwhile, medical waste originating from healthcare facilities can be destroyed in an incinerator.
Okay, next I will ask the Ministry of Health.
Okay, so first of all, I would like to say thank you so much for inviting me here today to discuss about medical waste. And so without further ado, I'll start our discussion. Here I would like to bring regulations about the management of medical waste. So, as the representative of Ministry of Health, I restating once again that we have passed Minister of Health Regulation number 18 of 2020 concerning the management of medical waste in area-based healthcare facilities in the public health center. Shortly, we have tried to educate and guide the health workers as well as the society about the harmful effects of medical waste. The implementation of Minister of Health Regulation number 18 of 2020 regarding health waste management itself involves several steps, including 1. Awareness and training. Healthcare facility staff should be made aware of the importance of proper medical waste management and trained on the procedure for handling, segregating, and disposing of different types of medical waste. 2. Planning and documentation. Healthcare facilities must develop a comprehensive health waste management plan that includes procedures for waste segregation, storage, transportation, and disposal. The plan must also be documented and regularly reviewed to ensure compliance with the regulations. 3. Equipment and infrastructure. Healthcare facilities must provide the necessary equipment and infrastructure to support health waste management, such as waste bins, storage areas, and incinerators. The equipment must be regularly maintained and inspected to ensure its effectiveness and safety. 4. Monitoring and reporting. Healthcare facilities must monitor that their waste management activities and report their waste generation, segregation, and disposal data to the relevant authorities. This helps to ensure compliance with the regulation and improve waste management practices. 5. Enforcement and sanctions. The relevant authorities are responsible for enforcing the regulation and imposing sanctions on healthcare facilities that violate the regulation. The sanctions may include fines, suspension, or revocation of operating license or criminal charges. Overall, the implementation of Ministry of Health Regulation number 18 of 2020 requires a concerted effort from the healthcare facilities, government agencies, and other stakeholders to ensure that medical waste is managed safely and responsibly. Proper implementation will reduce the risk of environmental contamination, protect public health, and promote sustainable development. This regulation, of course, has some goals itself. The goals of this regulation are to ensure the safe and environmentally friendly management of medical waste generated by area-based healthcare facilities. It to protect public health and the environment from the negative impacts of poorly managed medical waste. More, to promote sustainable development by encouraging the adaptation of waste reduction, reuse, and recycle practice, improve the quality of healthcare service by ensuring that healthcare facilities comply with health waste management regulation, enhance the capacity of healthcare facilities to manage medical waste effectively and efficiently, facilitate the provision of technical assistance and support to healthcare facilities for the implementation of health waste management practices. Overall, the regulation aims to establish a comprehensive and integrated system for the management of medical waste in area-based healthcare facilities at the public center, which will benefit public health, the environment, and the healthcare system as a whole. Therefore, I would like to reassure you that the Ministry of Health have made policies and regulations regarding how we should behave and act to the presence of medical waste and its hazardous. So I think that's all from me. Thank you.
And next, I will ask the cleaning volunteer. As a cleaning volunteer, how often do you participate in managing medical waste? And from the point of view of cleaning volunteers, how do you treat medical waste? And is it different from other waste processing? And if so, what is the difference?
As a cleaning volunteer, I have been involved in managing medical waste since the onset of the COVID-19 pandemic in Indonesia in 2020. The management of medical waste is certainly different from the management of non-medical waste. I will explain the differences in managing these two types of waste. The first is from the sorting and packaging. Medical waste needs to be carefully sorted according to its type and level of hazardousness. Usually, there are categories such as sharp waste, infectious waste, chemical waste, and pharmaceutical waste. After sorting, medical waste is packaged in leak-proof containers clearly labeled as medical waste, while non-medical waste can be sorted by type such as plastics, paper, metal, or glass. This sorting helps in the recycling and more efficient processing of waste. Non-medical waste is usually packaged in plastic bags or container according to its character. The second is from the temporary storage. Medical waste needs to be temporarily stored in secure and tightly sealed containers in designated areas to prevent unauthorized access or disease transmission. The temporary storage area for medical waste must meet specific safety and hygiene requirements. while the non-medical waste can be temporarily stored in waste bins or appropriate containers before being transported to final disposal sites or further processing facilities. The third is from the transportation. Medical waste needs to be transported using dedicated vehicles to avoid contamination and the spread of the disease. The vehicles used for transporting medical waste must comply with specific cleanliness and safety requirements. On the other hand, the non-medical waste can be transported using general waste collection vehicles. However, certain types of hazardous or toxic non-medical waste may require specialized transportation according to applicable regulation. And for the final processing, medical waste needs to undergo specialized processing to eliminate pathogens and the risk of disease transmission. Common processing methods include incineration, sterilization, or specific chemical treatment. The final processing of medical waste must comply with strict standards and regulations, while the non-medical waste can be processed through various methods, including recycling, composting, controlled incineration, or disposal in appropriate final disposal sites. The choice of processing method depends on the type of non-medical waste and the desired environmental impact. So the management methods for medical waste and non-medical waste are indeed very different.
I will ask to the Ministry of Environment and Forestry, what is the best solution or the innovation to solve this problem?
So as we all know, most of the liquid waste does not only contain heavy metals but also harmful bacteria or viruses and disinfectants. So a sterilization step is required. For example, the COVID-19 pandemic in Indonesia has produced many tons of medical waste in the category of hazardous and toxic materials or B3. Therefore, the National Research and Innovation Agency or RIN provides solutions with several proven technologies made by the nation's children to overcome the lack of medical waste processing capacity. Besides being environmentally friendly, this technology is able to process waste into something of use value. Some of these technologies can handle B3 waste, especially medical waste, by using the technology for processing liquid waste with nanobubble plasma, which already has a patent and distribution permit. The PNB technology itself uses ozone nanobubble water to sterilize medical equipment, disinfectants, and antiseptics. In addition to removing odors, dyes, or other harmful substances, this PNB technology is considered to be able to increase oxygen levels and be able to purify water polluted by waste so that it can revive aerobic bacteria. As for the processing of solid medical waste, such as personal protective equipment or PPE, remaining vaccines, masks, medical gloves, used syringes, remaining medicines, and others, this can be overcome by using plasma glassification and crystallization technology, which are very effective methods in decompose organic and inorganic compounds into the basic elements of a compound so that it can be reused and recycled. The solid waste treatment produces carbon monoxide, hydrogen, and metal scales which are not harmful to the environment. Because it is capable of increasing the capacity of medical waste treatment, this PNB technology created by the nation's children has the potential to generate added new value and economies. This technology has very low electricity requirements, is easy to operate, move movable can be upstream and downstream and is considered 100% safe because it does not use chemical in each of the process stage. So we ask the Ministry of Environmental and Forestry hope that the spread of this technology can be leveled across the region soon, if that is possible. That's all from me. Thank you.
And for the doctor, I will ask about the best solution or the innovation to solve this problem. How about you?
Okay, thank you. Maybe I have several solutions to solve this problem, such as said by Mr. Mohajir, who served as the coordinating ministry for PNK, that in general the condition of medical waste management in Indonesia is still facing challenge, starting from the regulatory aspect. Processing the role of local government, coordination between facilities and infrastructure institutions, the role of the private sector and financing beside that. The problem of transportation face challenge because there are only 165 licensed transportation service. This condition case transportation to not be able to reach all condition Indonesian health service facilities, especially in remote areas. Maybe there are several strategies that can be done to carry out medical waste management so that it continues to run smoothly. As Mr. Mohajir has said, that there are several challenges from the transportation system that has not yet obtained a permit. Therefore, it can be overcome by means of medical waste that is in medical centers. Small health centers spread across a city might make more sense with a collection and transport system than having semi-central care in one larger facility or even centralized care in a specific location like in a city, for example. So this is done to reach all medical waste in health service, especially in remote areas. The second solution or innovation is that we can carry out integrated medical waste processing using modern technology to process, recycle, and eliminate the danger of medical waste. For example, by using a medical waste incinerator, this technology is used to destroy medical waste. The way it works is that medical waste is heated at high temperature in a closed space to facilitate the destruction of organisms and other hazardous materials. Then the remaining combustion result in the form of ash can be disposed of safely. So this machine functions to sterilize and also destroy medical waste. And I thought, what if this machine was designed with monitoring and tracking technology, in which this innovation uses sensors or automatic monitoring to monitor and track the flow of medical waste from source to end. This helps ensure that medical waste is handled properly and also minimize the risk of spreading infection. I think this is my innovation.
Okay, thank you to doctor. And for the cleaning volunteer, how about the best solution? How about the best solution or innovation to solve the medical waste problem?
Okay, as a cleaning volunteer, the best solution I can give to address the problem of medical waste is the establishment of a mobile medical waste treatment unit. The reason I choose this solution is because of its flexibility in reaching hard-to-access areas and providing direct medical waste management solution on site. The mobile medical waste treatment unit is a facility for processing medical waste that can be moved from one location to another according to needs. As a volunteer, I will contribute to supporting the establishment and operation of this unit by performing various tasks, such as 1. Mapping and location identification. As a volunteer, I will assist in mapping and identifying locations that require effective medical waste management. These include remote areas, remote islands, or areas with limited access to medical waste treatment facilities. With the mobile unit, we can respond quickly and provide direct solution to the location in need. 2. Education and awareness. As a volunteer, I will play a role in providing education and awareness to the community and healthcare workers in remote areas about proper and safe medical waste management. I will involve them in training and education on correct practices of medical waste management, including sorting, handling, and transportation. The third is unit operation. As a volunteer, I will support the operation of the mobile medical waste treatment unit. This includes the collection, sorting, and processing of medical waste at the designated location. I will assist in operating the processing equipment, monitoring the process, and ensuring compliance with safety and environmental standards. And the last one is collaboration and networking. As a volunteer, I will contribute to building collaboration with local governments, healthcare institutions, and relevant organizations to ensure that the necessary support for the mobile medical waste treatment unit. I will play a role in networking with relevant stakeholders to expand the unit's reach and ensure its long-term sustainability. The establishment of the mobile medical waste treatment unit provides a solution that doesn't yet exist in Indonesia to address the issue of medical waste in remote areas. With this unit, medical waste can be effectively managed in the places that need it, reducing the risk of contamination and negative impacts on the environment and public health. As a volunteer, I believe that this approach provides a quick, flexible, and practical response to medical waste management in Indonesia. Thank you.
Okay, thank you for the clinic volunteer. And I will ask the Ministry of Health, what is the best solution or innovation to solve this problem?
Okay, so I think what the volunteer, cleaner volunteer exposed is actually right, that we need to use new technology to bring out to clean out the medical waste, but despite of all that, we also need the unity of ourselves. Like all sector has to be included to the solution and to what we say that we need to contribute, because this is not only our problem. It is not only the Minister of Environmental and Forestry problem. This is our problem as Indonesian, as one, not only part of us. I think that's all from me.
Okay, thank you, the Ministry of Health. And from all the speakers' argument, the conclusion is we can use the technology to solve the medical waste problem. For example, the first is nanobubble plasma technology, which has a patent and distribution permit. This technology also has very low electricity requirements that can save energy. And second, medical incinerator technology that can processing or recycling the waste by the heated at high temperatures in closed space. This technology can destroy the waste and destroy the organism that harm for environments, human and animals. The third, in addition, we can develop the mobile medical waste treatment technology for more effective waste management. And the last, we are not only use the technology to solve this problem, we need to be aware to this waste management for the healthy environment and develop and also realize the strategies to solve the problem. So, this is our panel discussion today about medical waste and to solve the problems. And I hope this panel discussion will beneficial to all audience. And thank you and good evening for all.